Hey, Scott, how are you?
Doing great, Mark. How are you?
Ready to kick off 2026?
Yeah, looking forward to it. It's been a lot of fun so far, and we should have another great year next year, I think.
Yeah, season four for us. So we're excited
Hard to
about
believe,
it.
isn't it? Yeah,
Yeah, exactly. And we have a very special guest with us today, who I've known for many years. And I think everybody in our industry knows Dan. So we
sure.
welcome Dan Mendelson to the program. Welcome, Dan.
It's a pleasure. Pleasure to be here and help you guys ring in the new year.
Here we go. Well, that's great. Real quick, just so I'm going to do just a brief introduction or a little bio, but Dan is currently the CEO of Morgan Health, a JP Morgan Chase business unit focused on improving employer-sponsored healthcare. Before Morgan Health, Dan founded Avalier, which again is one of the most influential health policy firms in Washington. And he spent decades advising CEOs and policymakers and being keynote speakers at conferences. And also, he's a regular contributor to Forbes magazine. So he's got a lot going on right now. So, Dan, I'm going to kick it off because, again, most of our listeners are in our world around drug pricing, market access, patient services. So we know you a lot from Avalier. So why don't you get us caught up on your journey since leaving Avalier and how you landed at Morgan Health?
That's great. Well, Mark and Scott, thanks. And it's actually really great to see both of you again. We've known each other also, from a lot of different contexts. But I'll take you back actually from before I founded Avalier to running the healthcare portfolio at the White House Office of Management and Budget under President Clinton. And there, I was really focused on improving Medicare, improving Medicaid. We passed the Balanced Budget Act of 1997, which not only balanced the budget, but also provided health insurance for 10 million kids. And I spent a lot of time focused on that. That was very meaningful work. Avalier was really founded to improve Medicare and Medicaid, and that was a primary area of focus. We certainly served market access, and I think part of improving those programs is making sure that there's really strong, appropriate access to pharmaceuticals. And a lot of that happened over those years from 2000 through to 2015 when I sold the company. When I sold the company, it had really evolved from a company that gave advice to a company that was using data and digital assets to improve patient experience. And so the sale was actually to a healthcare data company, and that was a great journey. Really enjoyed that. Spent a couple of years getting my feet under me, and then decided I wanted to run something again. And the one part of the system that I hadn't really touched was the employer aspect of things. And if you think about health insurance in this country, about half of people get their health insurance through Medicare or Medicaid. The other half are getting it through employer sponsored.
Right.
And as business people and as policy people, we spend very little time focused on this side of the equation, but it is very, very important, really, for biopharma, for services companies, as well as for others. Essentially, I was doing some private equity and some other things, and back in 2021, got a call from JP Morgan Chase, and they said, "Look, we're really interested in doing something meaningful in healthcare. Will you be interested in coming in?" And I was intrigued. So I came in, worked with the senior management team here. Jamie Dimon is very passionate about this issue, and he was ultimately the person responsible for starting this unit and bringing me in, and continues to this day to be very passionate about healthcare and wanting to drive increasing engagement in this area. So it's been a lot of fun.
What's the source of that interest and passion for him, Dan?
I think he's a patriot, and
Yeah.
he believes that part of achieving the American dream is having good healthcare. And so
Mhm.
many people in this country do not have it. And he goes out and he is a very hands-on guy, and he spends time kind of engaging. And that's, I think, a really big piece of it, that he thinks that all
Yeah.
Americans should have really strong access to healthcare. And then the other piece of it is that from the banking side of things, you see companies struggling with healthcare costs. So this year costs
Hmm.
will go up double digits, and it's bad enough for a company like JP Morgan Chase. It's even harder for a small business. And, again, like in my history, like I founded Avalier from scratch. We had no
Right.
employees
Yeah.
and we paid Cobra, for our employees in the first couple of years. And then we switched over and we got raked over the coals on rates. Had one of my dear colleagues had a cancer, and that year our rates effectively doubled in the following year. And like that was something that was really, really hard to absorb. And so, small businesses in particular really struggle with that expense.
Yeah, makes sense. How so tell us more about Morgan Health. How would you describe it?
Right. So the mission is to improve employer-sponsored healthcare. Seems simple, right? But
Mhm.
we all know healthcare is complicated, right?
Right.
And so what do we do? We're focused on improving affordability of healthcare, improving quality of healthcare, and improving health equity. And all of these are very important aspects of fixing the system. Um, the way that we engage is a couple of ways. First, we are equity investors. So we're investing off of the JP Morgan Chase balance sheet. We have deployed so far about $250 million of bank capital in 11 portfolio companies, and every one of them is focused on innovating in employer-sponsored healthcare, better primary care, better prevention, use of digital and AI to improve patient experience, um, helping employees figure out who are the high quality, low cost providers. Those are the kinds of things that we're engaged in. So one aspect of Morgan Health is the investment aspect, and we work very hard for our portfolio companies. They are part of the family. We
Hmm.
engage with them. We often sit on their boards or we advise them, and we bring kind of the full resources of JP Morgan Chase to improve their chances of success. Then the other aspect of Morgan Health is that JP Morgan Chase insures about 300,000 employees and dependents in the United States. And so we engage with our benefits team, and we don't administer the benefit, but we have close colleagues who do. And very frequently, the companies that we're investing in are of a high enough quality and engaged enough and large enough and dependable enough that we can deploy them in our environment. So in a lot of aspects, like we are an organization that uses the portfolio companies to kind of bring up the level of services that we're offering to our employees. So we're a strategic investor
Hmm.
as well. Those are really the two major aspects of what we do.
That's great, Dan. That's so exciting. I mean, I love that JP Morgan Chase is taking this on as you wouldn't think that it doesn't make sense that they would, but it's great that they are, right? And so from your experience, and again, everything else you mentioned, 11 companies, but are there investment theses like a thesis that you started with that you were looking towards? Like you said, it's very broad. So help us understand how you approached this.
We are focused on affordability, quality, and equity, and really all those different aspects. And when we invest in a company, we'll look at about 400 companies a year and invest in three. And those are rough numbers. Like sometimes we'll go a little faster, sometimes we'll go a little slower.
Yeah.
And for every company that we invest in, we establish key performance indicators, non-financial, that we are trying to drive. It might be about improving care for people with diabetes. It might be about reducing population cholesterol levels. It might be about increased access of employers to good data with which they can make good decisions about value-based services. And so for every one of the companies that we've invested in, we have the KPIs. And then, of course, we also track the financial performance because we want to make sure that our activities are accretive to the bank.
Yeah.
And I would say we're doing well on all fronts. I mean, we don't achieve every objective that we set out, but we're a very honest partner. And I
Right.
think part of being an honest partner is coming back to your partner and saying, hey, this isn't working for me. Or gee, you can do better in that area. And that's often what, we're engaging with our companies. And look, we look for organizations that really want to get the benefit of our experience. The other thing I'll mention back on kind of this idea of JP Morgan Chase, like why in JP Morgan Chase? And I mentioned, the passion for this of our CEO and our executive management team. And I mentioned, okay, well, we spend $3 billion a year on healthcare. Did I mention that?
Wow. No,
Mhm.
Um,
that's a lot of money.
in the U.S., right? But when you think about healthcare, it's 20% of the economy, and it's core to the way that J.P. Morgan Chase goes to market. So most large, outstanding academic medical centers work with J.P. Morgan Chase, and we want to be a great partner to them. And sometimes that involves helping them think about how to capitalize things, how to acquire downstream
Yeah.
assets, or it might be about how to better serve the community. And so the the objectives of a bank really have to be about improving the community that they're engaging in, and that's what we do.
Can you give us some examples from the portfolio? Anything that stands out? Have you been at it long enough to be able to see some winners or some things that need to pivot? Yeah, how's it going?
Absolutely. So a few concrete examples. In Columbus, Ohio, we have about 40,000 employees and dependents, and we feel that in advanced primary care. Are you from Columbus, Scott?
Yeah, I'm in Columbus now. Mhm.
Oh, that's excellent. Great town. I spent a lot of time there
It is a
actually.
great
So
town. Yeah, yeah.
and it's America, and our facility there is like America. Like it's the beauty of America, and then it's also America's healthcare needs. And so what we did in Columbus, we fielded an on-site advanced primary care clinic, and our employees can walk into that clinic and get primary care evaluation, mental health evaluation if they choose to do that. Obviously vaccines and other things that are proven to keep employees healthy. We bring a mobile mammography truck to the site. It's very calibrated to improving the health of the population. It's got a net promoter score right now of 88. Which
Mhm.
is outstanding. Compare that to the typical employee benefit where the net promoter score is like negative. Because
Right.
you know and then,
Right.
within that facility, we're also helping our employees find the lower cost, high quality clinicians. And we do that analytically. And so, and the clinic is run by Central Ohio Primary Care. They've been a great partner. So that's one example. Second example, Dallas, Texas, where again, like we have a lot of employees. There, we're deploying another one of our portfolio companies, Centivo, and what they do is they create low cost, high quality networks by partnering with a specific health system, and it's a narrow network plan. So if you opt to go
Mhm.
into Centivo in Dallas, you're going to be working with Baylor, and all your clinical care is going to be at Baylor. Now, Baylor's a great system, but you have to agree to
Yeah.
that. It's kind of like Kaiser in that aspect, but we share those savings back with our employees, and that's really how we run the program. And so the idea is, we want to experiment with this, and we want to make sure that our employees are benefiting from this because think about one of the biggest problems we have nationally is that employees are seeing the rise in healthcare eat into the increases in compensation that they're getting, and so
Right.
that's a problem that we're trying to solve. I could go on. We have about a dozen uh, kind of specific things that are running right now. We're getting data in on all these programs. We're very analytically driven. We have a whole data and analytics team on the Morgan Health Group that is focused really specifically on evaluating what is working and what is not working so that we can tout our
Yeah.
successes, more importantly, calibrate to make sure that we're coming back to our partners to help them be better.
Thanks, Dan. Do you have an example that generalizes beyond kind of where you have an employee population that, trying to enter the market more broadly?
Yeah, absolutely. So, one thing to mention is we're not just focused on JP Morgan Chase. We're focused on improving employer-sponsored healthcare nationally. And so,
Yep.
a nice example is we started working with a company called Involve Health. Daniel Stein is the CEO, great guy. By the way, if you're looking for people for
Mhm.
the podcast, he's wonderful. physician by training, really interested in getting better data to consumers about quality and costs of services. And we're working with Cigna to bring this technology into the Cigna uh, insurance offering. And again, we're doing it here internally within JP Morgan Chase, but it's focused nationally. And in bold, recently was acquired by a great company, Quantum. And Quantum has a much broader set of resources that it offers to employers. And they're starting to integrate these tools and methods into their broader service offerings. So, directly to your point, Scott, everything that we're doing is intended to scale nationally. And so,
Yeah.
Sentivo, uh, Vera, which, is also starting to scale nationally. Like it's really, the goal is to take what we know and really make it available to the full marketplace.
Dan, you mentioned primary care, which is great. You mentioned the networks, which is a huge part of this. You mentioned, obviously the data and quality. When you look to 2026 and beyond, what are the areas that you feel you have gaps that you need to potentially fill with some more portfolio companies?
Well, we're very focused on applications of AI in healthcare and believe fundamentally that a lot of the improvement that will happen over the next 3 to 5 years will come from AI. And so that's a place where, many, like we have one company, for example, Time Care. It's a oncology um, management company. And again, really excellent tools and methods. And they deploy AI to help deliver oncology services more efficiently. And they're doing very well in reducing costs and driving a higher quality product. And you think about like oncology, which I think starts to get closer to the immediate business interests and concerns of a lot of your listeners. Think about oncology, about the typical oncologist is getting paid kind of half on services side and half on the drug side,
Right.
and it is often true for a particular individual that if they're diagnosed in a major clinical center, that they could reduce their own out-of-pocket costs by getting chemotherapy in a community clinic. And often it's much more convenient for them as well. Who's going to help them figure that out? It is not going to be an oncologist practicing in the major clinical center. And so there needs to be a management function here, and there needs to be the application of knowledge that is derived from AI and digital kind of into these communities. So I'd say that AI is one. And then on the pharma side, kind of further, we just completed a really interesting early stage investment in a company called Aradigm. You might remember Will Frank. I don't know if you
Sure.
own personally or not. Again, like
Yeah.
just great human being, another physician entrepreneur. And his background, he worked in the government. He's been at CMS. He was at CBS, and now he's focused as an entrepreneur on addressing access to cell and gene therapies. And
Right.
that's a place we're passionately committed to that. I don't know if you saw recently there was a 60 Minutes
Yeah.
episode of a woman who is trying to get a therapy for her daughter, and lo and behold, it wasn't covered. Particularly big problem for small and medium-sized businesses because a lot of the products that are being offered to them do not cover these services, and most of these companies don't even know. They assume that if their employees get sick, that they are going to be covered, but they are not. And the Aradigm service offering is critical to being able to mainstream the coverage of cell and gene therapy. And again, it's the kind of thing that I get very passionate about fixing in healthcare.
Could we take a second? This is really great stuff, and congrats on the efforts here. The Could we take a step back and look through it from a little broader lens and marry it with sort of your background in OMB and the health policy world and all that sort of stuff? Tell us a little more about the costs and access challenge from the employer's perspective that you were talking about. What you know, what is your so a lot of stuff has been thrown at this wall historically, right? And we haven't solved it. Is the Kaiser numbers this year were $27,000, for a family of four to in premiums, 7 by
Yeah.
the employee and 20 by the insurer. So take the big picture here and put that in perspective for us, Dan. What's happening? Where's this going?
Yeah, Scott, it's like, yes, it's a target-rich environment. There are a lot of problems, and
Right.
um, the thing that I'm excited about here is that we get to work on them. I go in with a lot of humility, in the sense that we are making progress with respect to our work. To see that translated nationally will take time, and look, I think there have been historically a variety of efforts focused on the employer markets, and most employers, and I've seen this from spending a lot of time with a lot of employers over the last 5 years, most employers just want to run their business
Yeah.
and they want to provide coverage to their workers because they care for them and they want to see them, succeed, and they want to see them be healthy, and they know that that's their responsibility, but they don't have the time and the bandwidth to dive into all the details of healthcare benefits and the like. So they trust other people to help them with that. And that is really where we have to focus is
Mhm.
bringing them better product, and making sure that the people that they are trusting, for that information and for those services, are really fulfilling the needs. I think things have really changed a lot in recent years that will enable us to be more successful, for a couple of reasons. One is whatever the digital
Yep.
resources. We're kind of on the cusp of really significant change, and we're already seeing it happen in a lot of our portfolio companies, and they're growing nicely. And by helping them grow, we are accelerating that, and so that's kind of a nice thing. And then I think that it's also fair to say that with the rise in costs, it's getting to a point where we have to do something. We don't really have a choice.
And don't you think though that the CEOs, the employers that have they have the fiduciary, they have the ERISA risk, right? And so, but they are they utilizing that leverage that they have? Like, how do you approach it from both the responsibility they have, but at the same time,
Yeah.
the situation that they're dealing with these increasing costs?
I think they have less leverage than a lot of people think they do. Um, and sometimes they have less leverage even than those CEOs think they do. And what happens is that in addition to seeing the cost grow, they also have employees who are saying, I need better. And then insurance companies say to them, well, the way to get better is to spend more money. And it's this loop. And imagine like you're running the company, and I've been in this situation running Avalir, where you only have limited time to spend. You're not, as the CEO of a major Fortune 100 company, going to go in and re-engineer the healthcare system. And by the way, the person running your benefits is accountable also to make sure that the employees are happy. And that's a very significant motivator for them, and it's legitimate. And so it's up to us, it's up to Dan and Mark and Scott and everybody else who wants to take on this challenge, to be bringing better product in so that they can that America's business leaders can better achieve on their promise.
Well, as a follow-on, our obviously our podcast focuses on drugs, right? Access and affordability of drugs. You mentioned the cell and gene. What about the space between, before
Yeah,
we get to the cell and gene, right? Like, what's going on there? What can we do to make a
yeah.
difference there?
Candidly, so we've looked at a lot of PBM alternatives, probably a couple dozen, and we have not yet invested in that space. I think that what ends up happening with a lot of PBM alternatives is either they have like a narrow slice, they're focused just on generics, or they're focused
Mhm.
just on like one aspect of it, and they're not solving the whole problem. And a lot of employee benefits folks need there to be one um, nexus point, for simplicity's sake. That's not to say that we will never invest in a PBM alternative. I think that we're intrigued with the idea of point of sale rebates and these other kinds of things. But we're still looking in that area. I have a lot of very excellent and close relationships with CEOs. As you mentioned in the intro, like a lot of them have been my customers over the years, and I
Right.
continue to maintain those relationships. And we've had a lot of really good conversation with Lilly and with Pfizer and with other senior management teams about their direct to consumer work. And I think there's potential there. When you start selling direct to consumer, there's this question that I'd really like to be able to address, which is how does this comport with the benefit that employers are offering them? Because you go to Lilly Direct right now, and you can, like starting I think in 1/1/26, if I'm not mistaken, you can pay like $250 for your GLP-1. Well, that's more than what we're paying now, and so how do you square that out? And it's an important question. It's an interesting question. It's one that bears on the fact that companies will charge different prices in different contexts, depending on the formula, depending on a lot of other things. And so it's something that we're really very focused on that right now. But I'm going to say candidly, we don't really have a solution at this point. But we're very open to hearing, from the marketplace. So if you have listeners who are interested in talking about this stuff, like absolutely, like reach out to me. It's not hard to do.
Well, we can fill your airtime. There's no
Yeah.
doubt.
We have a few because this is
Yeah.
all we've been doing for 3.5 years, so
Yeah. Uh,
Right.
yeah.
if I could just follow one more, Scott, if I could just sort of stay on this, because there's been a shift on the drug side to, uh, more employees taking on bigger and bigger risk. Like, what can we do for the employees out there that are shouldering a bigger burden?
It's funny you asking that question, Mark, because like your companies have been the ones addressing patient assist, in a meaningful way. It's interesting on patient assist and kind of related policies. Look, we offer a very like internally within JP Morgan Chase is a very generous, is a wonderful benefit, very generous benefit. And so we don't internally, we kind of in our four walls get into that as much. I see it more in the broader marketplace, people who don't have insurance, people whose coverage does not extend to certain types of therapies. I mean, we cover GLP-1s for weight loss here, and you don't see that in the entire market. And so you have people looking for a lot of different kinds of solutions.
Right,
I do believe that employers are part of the solution, government's part of the solution, and pharmaceutical companies are part of the solution, and that pricing is problematic, and that when you're charging different prices for different people under different situations, there are these inconsistencies, and it drives employers crazy to see that. I mean, to use the hospital example, like we pay probably 250%
Yeah.
of the cost of Medicare right now for most hospital services. Let that sink in,
Yeah.
That is not a good situation. It causes a lot of friction. And when Medicare cuts the rates, what do you think happens? There's only one place for the balloon to squeeze, and that is brutal. Um, and it would not be good for the pharmaceutical industry to let that happen.
Yeah. Well, that undercompensation, if you want to say it that way or whatever, and the resulting cost shifting to the private sector to the employers is,
Yeah.
I think it's a long run, medium run threat to the employee benefit. I think the employer benefit. Um, so just to follow up on that part, Dan, let's step back and take a look at the policy environment then. Tell us, if you could, share your views about what's going on there as it relates to employer-sponsored healthcare and efforts to make it more affordable, and the PBM aspects, and really middleman
Yeah.
generally. I'll say thoughts there. What
Look, if
happens?
you
Is there anything that's going to happen that can make this better? And if not, then where does it go?
look at the macro policy environment, there are negatives and positives that need to be accounted for, right? And so, look, the fact that Medicaid spending has been reduced substantially in recent legislation, the fact that the subsidies on the health insurance exchanges are going down, these are negatives. They will stress the system. They'll
Yeah.
stress providers. They'll stress the pharmaceutical industry. They'll stress anyone, so those are on the negative side. On the positive side, I do think it's really valuable that the administration is focused on AI and technology. So that's a good thing. They're very interested in leveraging private market tools and techniques. I think they've established stability for Medicare Advantage, which is important for the system, and I hope they continue to do that. Look, the policy environment right now, I think, is going to increasingly be focused on affordability, one way or the other,
Yeah.
because consumers are struggling with cost, and it might take us a little while to get there, but there are solutions. I like some of the solutions around ICRA. That again, it's a smaller portion of the market, but I think that
Yep.
that's potentially positive. I like the idea of giving more flexibility so that insurers and health systems can field products for
Dan,
consumers.
can you just explain that real quick?
Oh, ICRA, you mean? Or
Yeah, yeah. I'm
yeah,
sorry
I'm
to
sorry, I
interrupt,
used
but
an acronym. You know, individual coverage healthcare reimbursement accounts, ICRA. So if you're a small business, and you go out and you look at what's commercially available in terms of insurance, and you don't like it, you have the option of giving your workers a check, and then they go and buy insurance on the health insurance exchange.
Right.
In markets where the health insurance exchanges are strong, it's a great option. And because your employees will get choice and they'll be able to get a product, and you can probably pay less in broker and other fees as an employer. And so, this is something that the government can make a lot more accessible. And there are a range of policy options here that we support that can improve access of small businesses to be able to subsidize their workers directly and let them buy insurance under the exchanges.
that's an example that's a great example of sort of like how the policies leads to employer-led innovation, right? Like
Mhm.
that's are there ever things that the government's doing or policies doing that could unintentionally shut doors?
Say more.
Could Well, I mean, shut doors, like, they'll put you wanna do innovation around, AI, and they put a policy that says you can't do that, or you wanna create
Yeah,
health wallets, and they come out with a regulation that says can't do anything
yeah.
that around health wallets. Are they unintentionally shutting any doors for innovation around employer-sponsored healthcare?
Of course, that is always a risk when it comes to regulation. I do think that this administration is focused on not shutting doors. Like I think they want to create an
Mm.
environment of innovation, and the CMS policy officials that I've spoken with recently are really interested in places where doors are being shut, and they want to make sure that they're not being shut. Like that is again from the CMS side. So, again, I think that they have said, Dr. Oz and others at CMS have said, the door is open. And I think they really mean it. Like we've had a lot of our portfolio companies come in and talk with them. We've gone in and talked with them. They're interested in hearing from us.
Dan, any learned words of wisdom for you've been working with early stage companies, startup, entrepreneurs for some time now. What advice would you have for entrepreneurs trying to make a difference in healthcare?
I would say first is focus, is making sure that, focus is very narrow on the problem that you're trying to solve. Um, there's a level of practicality, I think, that
Mm.
the early stage uh, companies need to have, of like making sure that they sign 3 clients as soon as possible so that they can have like that practical test bed for their technologies, and then they need to be flexible. So it's like being clear about the problem that you're trying to solve, going in and getting like a 3, 12, whatever it is,
Yep.
like real clients in the door as rapidly as possible, so that then there's like a level of innovation that can
Yeah.
happen. Is really, I would say, kind of the hallmark of the successful companies that we've seen. And not every company will succeed, of course.
Yeah.
But again, as an investor, like we invest in companies where we want to see them succeed. So we're working hard to make sure that they do.
Right.
Well, you mentioned earlier about you're looking for ideas on the drug side, right? So let's say you are a founder of a health tech company, and you want to come pitch you and your team. What advice do you have for those founders as they think about pitching you?
A couple of things. Great question. So first, we focus on companies that have revenues and usually have those dozen customers already. And
Hmm.
so, um, if you want to engage with our team, that's what we are looking for. And I think it's important to know what your investor wants and what they don't want. There are plenty of companies that invest in pre-revenue stages. We do not, and so that's kind of the thing one. Um, Thing two is that we like to see evidence that the tools and technologies work. It's great. Like every entrepreneur can talk you blue in the
Hmm.
face about the problems of the healthcare system and but like we like to see a carefully designed analytic study that shows that what they do works. And unless we see that, we don't take the time to meet with them. And I
Hmm.
think it's really important to understand that it's no offense to anybody. It's just a matter of the fact that we're looking at 400 companies to invest in three every year, and so we have to make sure that our team is being efficient about how they engage, particularly at the early stages. And then we like to know that our engagement is really going to make a difference, a meaningful difference in accelerating the companies. And that's something that you know, it's important for a company to understand who we are and who we're not. Like if they're looking to us to deliver 10 insurance companies, we're not the right investor. They should go to Echo or Sandbox or one of those others. And so if they're looking to really gain a lot of knowledge and expertise in employer markets, we're a good
Hmm.
investor. And then if they're looking for kind of the backstop of JP Morgan Chase, we're a good investor. Like, so there are things that we carry, other investors carry. So it's important to understand, kind of what the strengths and the weaknesses are of any given investor.
So, Dan, at the end of every session, we always invite our guests to wave their magic wand. And if you were in charge for the day, we wonder what would be your prescription to improve access for medicines for patients better.
Oh my God. That's so cruel. I have a magic wand. I look under my desk.
Yeah.
I don't I don't see it there, Scott. Look,
We'll
like
have to mail it.
I am a realist. Um,
Hmm.
and so I think it's important for all of these stakeholders to come to the table and have like really honest discussions about cost and access. And I'm working on the employer side right now. And look, we as employers want to ensure that there's really strong access. At the same time, they have issues with prices and trying to make sure that everything that's coming down the pike is actually going to fit into that benefit. So, I think honesty is important. I think data is important. If there's one thing that I wish, I'll give you one. I'll give you one.
Yeah.
I wish that the industry was much more hospitable to policy and legislative efforts that would make data more accessible to buyers. And like I've operated in Europe, I've operated in the United States, as you have as well. And the data that the European health systems get enable them to navigate more effectively. And they do that through their regulatory mechanisms. I sit on the board of Peterson Institute, and there's a lot of focus there. Caroline Pearson is great. If you haven't had her on, you got to have her on.
Sure.
And again, like they're focused on bringing data and information into this ecosystem. We have to support that more. I think the industry has to support it
Yeah.
more, and it's important for the future of pharmaceutical therapy in this country.
Yeah. Well said.
Yeah, no, absolutely. Dan, thank you so much for joining us. Thank you for your thoughts. Um, you now get to find out how good we are as listeners, and as we like to just sort of summarize with sort of key points that we want people to walk away with, right? So, Scott, you want to go first? You want to?
Yeah, so I really appreciate this conversation a lot, Mark. We have, I would say, at least in retrospect, we haven't spent enough time on the employer perspective of what's going on here, and it's great to get to do that, and it's especially great to get to do that with someone like Dan, who's had all this wealth of experience and connections and exposures, and is so well regarded for how he's navigated all of that and the things he's learned. It's wonderful, I think, to see the engagement of JP Morgan Chase in this fashion. I mean, how amazing is that? And and to hear that, it comes from that Jamie Dimon personally cares about this and, wants to make a difference. That's a big deal. And you know what? I think that feeling is more common in healthcare than we understand. One of my bosses said years ago, it's not by chance, that people work in healthcare. And folks know we're not doing well enough, and they want to be part of the solutions. And I'm just thrilled to see Dan working on it and JP Morgan Chase working on it. They got a ton of lessons. I loved all this stuff about the role of the employer, Dan's policy views, all those kinds of things, but I'll stop there.
No, I think those are great points. I think you hit on a couple of that I was going to mention as well. I'm going to just go into the concept of the what he sort of wrapped up with, which is that policy can make a difference, right? Like good policy can influence things in a good way. I think we're all we've been doing this long enough. I know Dan as well, where everybody thought that it was the Democrats who would push big changes in healthcare, but it's actually been things like, you look at President George W. Bush, right, and what he
Yeah.
was able to pass with the prescription drug for Medicare, and President Trump seems to be much more active and engaged in trying to solve some of these things. So I think that the role of the government as a facilitator to action is really critical. And again, like you said, somebody like Dan who could play this role
Yeah.
and help us sort of wedge in some things that could really make a difference for employer-sponsored healthcare. Because as an employer, we have 1,000 employees. It's just painful every year, right? It's just like you're taking body blows when you sit in those meetings. So
I agree with that. The other thing it makes me think, Mark, is we should spend a little more time talking about innovation here as well with some of the kinds of companies that are working on this stuff. I think our listeners would appreciate that.
that's a goal for 26. So
Yep.
we'll look forward to have more of those discussions. In the meantime, Dan Mendelson, thank you so much for joining us. We hope you've enjoyed it. Hope it's been great. And we are just
It's
thrilled
been
you're here.
awesome. You guys said too many nice things about me. I'm going to have to make sure my parents
Yes,
did this.
exactly.
I will. I'm like, my parents
That's our
live in
target
Bethesda
audience,
going,
our guest parents.
And your daughters, because they'll
my
That's
daughters.
right.
Yeah,
yeah,
exactly.
right.
Know that I'm not a
So,
complete screw up. Exactly.
right.
Yeah.
Well, no, it's great. Well, thank you. And also, thanks to my partner, Dr. Scott Howe, and to the team at Resonate Recording. And we're thrilled to be back for season 4 of Prescription for Better Access. And if you have any questions or comments, please let us know at comments@prescriptionforbetteraccess.com.
Resonate.